No matter your social, economic, spiritual or political status, health is a great determinant in your life. Many people have failed and still are due to poor health. To build up our economy, take care of our spiritual life, develop our families, we must take care of the health sphere. Welcome to our new show, The Health Watch. Before we start our first discussion, Health in a Nutshell, let's establish understanding on why health by my co-host, Nixon Ratemo. Karibu.
The 21st century is under some form of poor health spell. A few decades ago, diseases were few, and the simple ones like malaria and cold could be handled in very simple ways. However, with the dawning of time, more diseases have erupted and simple ones have become more sophisticated. Health is a resource for social and developmental means. Thus, the dimensions that affect these factors must be changed to ensure good health. To any living organism, health is a matter of serious concern. In the absence of good health, one can barely think, live alone, fend for themselves and for their families. Actually, poor health means no food on the table, low life standards, and a poor economy for the country. I managed to talk with a few people in the streets of Nairobi, and this is what they had to say about their health and how they are taking care of it.
I can't really say I'm healthy or I'm not healthy because I don't have the parameters to gauge whether I'm healthy or I'm not. But according to layman's language or layman's point of view, I can say I'm healthy because I'm feeling my body is okay and I'm feeling in my stable condition of health.
Let me ask you this, how often do you go for medical checkup?
When I feel some illness in my body.
What if you're just okay, like right now?
I don't visit the hospital. So
don't you think that is risky? You're risking your health?
Yeah, it is risky, but you know, at this point of life, we're engaged in so much things to do about life, like earning a living, and we forget about our health. But the minute the body responds something to you, it is now when you rush to the hospital. Otherwise, I will say also, there is no much, let's say, awareness about going for checkup because I'm feeling I'm okay. I take it for granted that
you're
I'm
okay.
Yeah.
Now, tell me something else. We have the loss of health. For example, your food. Are you careful about selecting the kind of food that you eat?
Not really.
You just take any?
It goes with what I feel like eating on that day.
So your appetite controls you generally?
Yeah, it controls me.
I consider myself healthy.
What parameters do you use to say that you are healthy?
I try to eat healthy and work out a little bit.
You are a lady, and many ladies like junky foods. I don't know, how often do you take those kind of foods?
I try to take like once in a week. Yeah, but I'm not into junk all the time.
Let's talk about exercise. How often do you do it?
I walk a lot and just try. I don't really go to the gym. I try just to walk a lot around the areas and just use the stairs when necessary instead of using the lifts. Yeah,
Okay.
so I consider that exercise.
Okay, thank you. Now, last one. What plans have you put in place to make sure that you maintain your health in the future?
Right now I haven't put any plans, but I'm trying to get a medical cover. Yeah, so that in case of anything, I'm covered and protected.
Do you usually go for checkup even when you feel you are okay? Medical checkup?
I haven't done a whole body medical checkup because I haven't felt like my body is breaking down. So
Tell me, do you think you're healthy?
Yeah, of course.
What makes you think that you're healthy?
I'm in full. My body is good. I don't have any disease. I don't have any sick. Thanks God.
Amen.
And I'm healthy because I'm young. I'm healthy because I'm happy. I'm healthy because I practice sports. I'm jogging, I'm playing football.
You do a lot of exercise?
Yeah. I exercise.
What about you? Do you think you're healthy?
Yeah, I think this is the same question for me. I think that I am not sick. That means me not healthy. And taking good foods and practice sport and enjoy the life. That's make you not happy, but even happy in your life.
Okay. You usually go to hospital for checkup?
Yes. For when I got flu, for example, I do a checkup.
What if you have, there's nothing at all, no flu, nothing, you don't go to hospital for checkup?
Yes. Checkup.
Don't you think that is risky? You might be having some disease that is hidden within your body.
Some people speak about this, think you should to do a checkup every day, at least, every year at least.
Yeah.
But for me, I'm young. It's not time to do checkups because when you do checkups, you will be obsessed by your health, and you will be sick. Okay, because you are obsessed by your health.
And you are supporting him.
Exactly.
That we don't need to do any medical
Exactly.
checkup.
Don't think that way. don't think at all.
Okay.
Just to be positive.
You need to only be positive.
Exactly.
Okay, thank you very much. I appreciate.
you.
God
Thank
bless.
you.
Thank you very much. Have you seen a family or been in a condition where one of the family members is affected by a certain serious condition such as cancer, diabetes, or any abnormal growth? How much is required to treat such a person? It becomes even more humiliating if such a person should die and leave the family in great debt. Sometimes this is not normally the case. It may just be a case of pain and suffering. Diseases deny the person suffering any kind of happiness. In the current world, many are groaning in hospital and home beds because of serious diseases, and their family members and friends are watching helplessly. According to the World Health Organization, non-communicable diseases were responsible for the 68% of all deaths globally in 2012. As sad as it is, most of the current diseases and conditions in this life could easily be avoided. To provide necessary information, suggest simple preventive and curative measures, and inspire right living is the intention of Health Watch.
Welcome to the show Health Watch. Today our topic is health in a nutshell, and together with me in studio is Dr. Kahindi Shadrack, a medical practitioner, a preventive and wellness doctor, founder of the Emerald Preventive Healthcare, practicing at Down to Earth Digestive and Wellness Center. Karibu Daktari.
Thank you, Eva.
What is health?
Health is the well-being of a person, and we say it's not absence of disease, but it's well-being of being physical, spiritual, social, and even emotional. So it's not just an absence of disease, but when you are being in all those areas, then we can say you have good health. Yes.
Why take care of your health?
We move and function because we are in good health. And therefore, the work that we do, the activity that is seen out by our bodies is because we are in good health. And therefore, we need to take care of our health because we say, you create wealth because you are health. Health is wealth. Yeah? You can be able to interact, enjoy life when you're in good health. You can be able to enjoy your family with your family when you're in good health. So without good health, you cannot enjoy the good things that God has created for us. So you need to take care of your health.
Well, lately, there's been a craze going on around town. Everyone is keeping fit. People are joining fitness studios. You see before and after pictures of people on Facebook of how they used to look. People are juicing, they want to drink, they're on a fasting diet. What do you think could be the cause of all this?
I think it's the awareness of being well and being fit is what people have actually understood, that it is important to be fit. It is important to take care of your health. And therefore, if I had a problem that is termed as being unwell in me, then I have to look for remedies for me to be well. And therefore, let's say like the crazy of weight reduction, such as that, it's good because you realize most of the diseases, and we call them lifestyle diseases or non-communicable diseases, are related to our lifestyle. And therefore, if you have a risk factor, let's say you are drinking, you are smoking, yeah, you're overweight, diseases like high blood pressure, diabetes, cancer are related to these risk factors. And therefore, you need to take care of yourself because the health is in your hand. And therefore, it's good, but let's not overdo things, because I see people going for crash programs, reducing weight within a very short period, and you see the body takes it as a shock. And we've had some people even getting sick because of crash programs. And it's good to go to a very well-qualified medical doctor or a clinician where you can get right guidance. Not everybody, because everyone now wants to do wealth and wellness. And people who don't have certificate. And that is the danger of just putting yourself in a program without being followed up by a good clinician or somebody who's qualified to do that. Yeah. And therefore, because of those gray areas, because we don't have doctors who are really practicing preventive and wellness, we find others who have just come in who purport to be doctors, but they're not actual doctors. They don't have the credentials to practice as doctors or as clinicians. And therefore, we need to be a bit careful, the people where we go, to get these programs so that we can be. And sometimes people go to the internet and they get programs. Sometimes it does not work for them. So it's good to be guided. And you see, many times it's because of your lifestyle. So if you get a good guidance from a doctor, then you'll be okay. You can shed your risk factors. Yeah.
Thank you very much. The state of being healthy. What could you tell me? What causes the state of being healthy? If I call myself healthy, what should I be?
The state of being healthy, as we have said from the introduction part, is that it comprises of your physical health, of your mental health, of your social health, mental, emotional health also, and even spiritual health. Your physical health is your body. Yeah. Are you exercising? Are you eating well? Are you sleeping well? Are you drinking enough water? Those are things that base our bodies to be healthy. Yeah. So if there's one of these things that I've mentioned which are not there, also temperance, we talk about people overdoing things, overworking, even oversleeping, overeating. Some of those things contribute to bad health. But everything, if it's done in the right way, following the things we call the natural laws of health, then you can be okay. When it comes to mental health, we say, what you behold, you become. What your eyes see, you become. Yeah? Therefore, if you want to be positive, you have to read positive things. Yeah. You know, in our brain, there are two minds. There's the positive mind and there's a negative mind. Yeah. So if you choose to feed the negative mind, you'll be negative. You may even not enjoy when you're going to exercise. You may not even enjoy when you're eating your food, because there are so many negative things within you. And we have the social health. You know, as human beings, we are social people. Yeah. And therefore, we need to interact and make meaningful relationships with the people around us. Yeah, that is the wealth that God has given us. We can't live alone. We are interdependent. And therefore, creating communities of people who embrace one another is very important for good health. If you're living in a family that each one of you are taking care of each other, then it's very important. It's unfortunate that the fabric of the African culture is disintegrating, but remember, Eva, back times when you used to be small, you used to live in big families, extended families. You are a son of everybody. You are a child of the village. Okay. But these days, it's not there. So the fabric also affects the social health in us. And therefore, you can see there are a lot of social injustices that are being done. And you can see somebody doing something bad and you just walk away. And those are the things that really erode our social fabric and are causing diseases. Because you have people who are psychologically sick because either they have been battered at home, they have been abused at home. Those are all social areas. And we talk about emotional, our family breakups, relationship going bad, those things affect your emotional. Then now finally you talk about spiritual health, It's been shown that those who believe in God, the creator God, who created us, have hope, and even when they get unwell, they still have hope. They can heal even faster when we talk about health. And therefore all these things contribute to the state of health.
Awesome. According to the statistics, the number of mortalities that result from non-communicable diseases have gone up in the recent past. What do you think is the reason for this?
Yes, I would like to answer that question in a bit structured way.
Yeah.
One of it is what we call civilization, and one of it is what I've just talked about, the disintegration of the social fabric, and the other thing is now our lifestyle. Because of civilization, our lifestyles. Most of us now are living in towns more than we lived in our villages, where there was fresh air, where food came from the shamba, where water was natural. Natural water from the rivers had so many minerals.
Yeah, from the spring.
When there was no much of contamination in the environment, environmental pollution. And therefore also, because of living in towns, we don't have many recreation centers, and most of the recreation centers that are there, you have to pay. And therefore people have become a bit sedentary. There was an article the other day in the news that young people and those who are in the middle class or wealth families, they don't exercise more. Most of them are in the internet, they're in the gadgets. So their lives are more sedentary. And we find these are the same people who go for fast foods, sweet products, other soft drinks, and they're not exercising. They're always doing things in an enclosed place, And also because of that, some of them lack good sleep. And all these things contribute to these non-communicable diseases. Name has the cancers, the high blood pressure, the diabetes, because of these lifestyles. And you see, some of the risk factors of these diseases, I've said, is overweight, obesity, lack of exercise, poor nutrition, what we call fast foods, And also, inherently, we have people who, because of nutrition, the use of a lot of sugary foods, also add to that. And therefore, these are contributors to these diseases. And therefore, we are seeing an upsurge of diseases, or non-communicable diseases, even in the young people. And also because some of these diseases don't, when they appear, when you have symptoms, you're actually, it is also already advanced, like cancer, diabetes. So you find people go to the hospital when these problems are advanced. And therefore, the other thing that, as much as we are saying we are civilized, we are not very much aware of doing yearly medical checks, being checked every time. Some of them you may have covers, but they don't go to the hospital to be checked. So these are some of the things that are contributing. And now what you're saying now is good that you go for your health check. It's good that you embrace wellness. It's good that you start looking at your weight, you start exercising, you start eating well. So some of these things will help us now reduce these diseases.
Okay, you just mentioned something. If I keep going for checkups, regular checkups, and I'll be able to tell of my state of wellness. So where would you advise our viewer to go for regular checkups? He's never falling sick, he's just fine. Why should he go for it?
Thank you for that very important question. As a preventive wellness doctor, my message to the viewers is you don't have to be sick for you to go to a preventive wellness doctor. for you to go check yourself whether there's a problem. You know, most of us, and all of us, have certain risk factors, health risk factors, that can only be detected if you go for a check. Our bodies are not perfect. And we realize we are all aging in one way or the other. And therefore there are things that crop up that can only be detected if you go for a checkup. You can be well, but there are things that the doctor can pick, that the doctor can tell you, these are the areas that you need to start focusing on. Because slowly by slowly, these are the ones that will bring conditions to you, diseases to you. And therefore, a medical check is for everyone. A health check is for everyone. And as we said, cancers, if you catch it early, it can be handled. But if it's catch late, it cannot be handled. The same to diabetes, high blood pressure. These are some of the diseases that they may not, like pressure, it may not present itself in a dramatic way. So medical checks help you to detect yourself. And we talked about prevention, detection, mitigation, so that you can be able to be put back to the right fit, the right shape. So the early detection is important and can only be done through the medical checks.
Dear viewer, don't go away. We are running for a short break, but remember the doctor has talked about 3 things: prevention, detection, and mitigation. Those 3 things are very important and we need to think about it. Don't sit at home when you're feeling you're healthy, you're not sick. Go and have yourself checked. We are going for a short break, and during the break we shall watch a feature on simple health practices. Do not touch that dial. Welcome back, dear viewer. We left off at the point of talking about prevention, detection, and mitigation. Dr. Kahindi, please expound on these 3 things. I would like our viewer to understand what it really means.
Well, as we all know, prevention is better than cure. When we say prevention, it's actually stopping a disease or something from happening. And therefore, you may be well, but you need the awareness of how to stop yourself from getting a certain disease. And therefore, the health education that goes along with prevention is to educate you to make sure that you don't fall sick from a certain disease. Let's say, for example, in your family, there's a problem with high blood pressure. And here you are, you're not embracing good health. You may be overweight, you may be drinking, you may not be exercising. When you talk about prevention, because you are not yet hypertensive or don't have high blood pressure, then we tell you these are the things that you're going to do so that you don't get blood pressure. So that is prevention. When you talk about detection, is now the part of medical check. You go to a doctor, they can screen you, they can do lab tests, they can do other tests to detect if there's anything in your body. That when we talk about cancer, we talk about early detection. For ladies, if they want to check about cervical cancer, they go for pap smear. Breast cancer, they go for mammogram. For prostate, they go for the prostate surface antigen and ultrasound, so that we can detect where there's any element of cancer cells in your body. When we talk about mitigation, now these are interventional programs that we put somebody whom we have detected or we have identified a problem to be able to reverse it, and give a cure, sort of, so that he can go back to normalcy in his health. So basically that's what we're talking about when you talk about preventive and wellness. You want people to be fit. You want people to stay fit. And if you're going to grow old, then you age what called gracefully. Yes.
I like that word. So, what practices can one adopt as disease preventive measures?
Well, there are 8 principles of health, which generally we talk about good health, good nutrition. And when we talk about good nutrition, we talk about balanced diet. And sometimes it may be affected by your environment. And when we talk about balanced diet, we talk about a diet that comprises of the starch or carbohydrates, the proteins, we talk about the sugar, the fruits, the vegetables, all that. So that, vegetables and fruits are good for immunity. They boost your immunity. Carbohydrates give you energy. Protein build your body. Therefore, food have to be balanced. But also, when we talk about nutrition, we also talk about the eating pattern of people. Yeah? You cannot, today you're eating at 9, your breakfast, the other day you're eating at 5, this day your lunch you're taking at 3, the other day you are taking at 12, supper, the other day you're taking at 10, the other day you're taking at 7. You see, you confuse the digestive system. Yeah? We talk about eating pattern, that's where people get indigestion. So even the eating pattern is important. And also the mixture of food sometimes affects absorption of some certain nutrients. Yeah? So those are the things that we talk about in the nutrition. And also we advise people to take more of raw vegetables also, which are good for health. When we talk about now, the other principle is exercise. A very integral part. In fact, would you say, when you start exercising, it gives you dividends. Or it gives you bonga points immediately. You feel good. You see, when you exercise, there are hormones that are produced in the body that make you feel nice. But also, as you do that, your body becomes effective, especially the heart becomes more effective. And therefore, it's been shown to help in prevention of diseases, cancers, diabetes, high blood pressure, most of these non-communicable diseases we're talking about. Then water. Our body is 7% of our body is water. Water is a purifier. One of the questions people ask, if you use a whole gallon of water to shower, what about the inside that produces that outside that you clean? What you are saying is that water is integral to clean your system. The purifier of the body, the kidneys need the water to clean out your body. And therefore, if you deprive your body of water, that means you're starving your cells. And therefore, the aging part starts. And that's why when you go to a hospital, if you have not been taking enough water, the doctors will add you water. They will put a line and they'll add you water. But what they're saying, it's also, have you seen somebody who does not take water? They look old, but when they start taking water, their faces started glowing. Even when you take a patient who has lost water, when they're given water, they glow. Yeah, they just wake up. Gets back. Yeah. The life gets back. So what is integral? Then we talk about temperance. No, sunlight. We get vitamin D from sunlight, and here, most of us are non-Europeans, so people who live in towns, and we have children. Sometimes, as mothers, as fathers, you tell the maid not to take the child outside, and they get deficiency of calcium, and the bones start bending, what we call rickets, because they're not taken out. Because the sun, the one that in the morning is important, they have the element of the sun rays that we call the W light that helps in the synthesis of vitamin D. The vitamin D is also an integral part for making the calcium to enter into the bones. Therefore, we have many, even adults that are deficient from vitamin D. And along the way, they get problem with arthritis, poor bones. The other thing that we talk about is temperance. Temperance here, what we take is avoid that which is bad to your body and take that which is good to your body in moderation. You may have all the food before you. And as we go to the festive season, I think it's good. I'm sure we are going to ask about that along the way. But as we talk about temperance now, we can touch about it. Here is, you have been so busy during the year. You have hardly been catching free meals. Yeah, sometimes you go without meals. Here is holiday. You are at home. You start from the morning. You're just eating until evening. It's a shock to the digestive system. It's a shock to your stomach. Because it's not used to that. And then you start getting indigestion, you start being groggy, you start being lazy. Then when January comes, you're very sick. The system has gone kaput. Temperance. everything in moderation. Yeah? Avoid that which is bad. I'm sure during this period, for those who are not born again, especially the young people, they'll be the one who will first smoke. They'll be the ones who, to the first time for them to start drinking. What we're saying, avoid those things that are bad, because this will affect your health. When we talk now about air, good circulation around the house, around the environment, aeration, open the windows of your house, let air come in, let it circulate. Fresh air, for those who like exercising, go to the fields out there and exercise with this fresh air. If you can't, early morning where the air is still fresh. So air is very integral. And also we talk about rest. Many of us don't sleep well. They don't take resting as important. And many times people sleep like 4 hours, 5 hours. We advise people to sleep at least 6 to 8 hours. And the good sleep is that one before 12. Because then you get all the full range of the sleep pattern. And it's said that the best sleep is the deep sleep, where now the body really rejuvenates itself. And that happens around 3, 2, 3, 4, you're almost waking up. But most of us, when you go to sleep, maybe after 12, you may not get that kind of sleep. So you may not be rested. Have you realized when you sleep after 12, many times you wake up feeling your body is aching? Yeah? That's what happens because we are not following the biological clock God has created in us. The other thing we talk about is trust in God. As you've said, spirituality affects health. And we've seen many of people who believe in God as a creator and are Christians, they have shock absorbers in their life because they know there's a God who up there who is taking care of them. And as the Bible says, do not worry about tomorrow. Let that day be that day. Leave the tomorrow to God. And when you're sick, there's a God who heals. So the spirituality becomes an integral part of wellness, of good health. Because studies have shown that those people who have hope in God, they even heal faster than those who don't have hope. And therefore, those are the simple principles that when we embrace, we are able to be healthy.
So, well, that will bring me to another question. Does it mean that if I do not know God, or if I don't have a spiritual footing, then if I got, say, an uncommunicable disease, it will be difficult to heal me, or it will take some time before I get healed?
Well, not necessarily.
Oh.
Not necessarily that. But one of the things that happens in that person who believes in God, there's a hope. Healing is very psychological also. Yeah? The people around you, if they're believers, the support system is much, much better than those who are not believers around you. And therefore, the healing process can be faster, has been shown to be faster to those who have a hope, believe in God. When you look at this other person, it does not mean he will not get better, he'll get better. But when you start talking about, areas of stress management, yeah, where somebody believes that it's him and only him who can tackle his problems, then leave it to a super being who is God to tackle it for him, then it causes a lot of stress. And therefore, stress has been shown to affect healing, even in diabetes, in high blood pressure, even in cancer. You need a mind that is settled. You need a mind that embraces, that you can say, let the doctor take care of the rest. Let me not worry so much. Because the worrying also affects the healing. And therefore, we're not saying that the people who don't believe in God may not get healed or will take very long, but you can see that those who believe in God, their healing might be much faster when it comes to that, because they believe they have the hope in a God that they trust, they believe in.
Just before I get to the next question, there's still something that has just hit my mind. Well, what relationship do we have between health and music? Because lately, there are different healing procedures, and I'm told music is one of them. Might you know something? What is your opinion?
It depends on which music you're talking about, Eva.
Yeah.
There's the music that can suit you. Yeah. You see, in our mind, the brain, there's an area that is very receptive to soothing music. Yeah, and therefore cools down emotions, or we call temperatures in somebody. Yeah, and there's that music that makes you agitated. Yeah, the bam bam bam, the pop music makes it want to jump.
Yeah,
that makes you to feel like you're flying. Yeah, that's not a music that can suit you for healing.
Yeah,
you've realized for people who have problems with maybe depression or high blood pressure, these chronic diseases, when they go to a quiet place with soothing music, you've also know that people who want to design and want to think, they can put a very background soothing music and they think more. I know of my fellow doctors who operate with soothing music. You concentrate. Yeah? It's unlike the banging music, the one that causes noise. It disrupts thinking, your flow of thinking. So that's how the different it is when it comes to music.
Yeah.
So there's that music that can suit you, there's that music that makes you agitated. It disrupts your mind and it causes disease to you. It can even rupture your eardrums.
Yeah. Well, thank you very much, Daktari. My dear viewer, this program is very, very informative, and that's the reason why I do not want you to move an inch away from your screen. We are going to move to the health snippet, and our health snippet today is about the Kenyan health status. So if you want to know more, sit back right there and watch what we have for you. Don't touch that dial.
Kenya has a postulated population of 46,050,000 people. At a growth rate of 2.9% per annum, the population is expected to increase to 77 million people by the year 2030. The total health expenditure per capita by 2014 stood at $169. Health services are provided in public and private hospitals and dispensaries, community healthcare centers, and nursing homes. Life is normally sweet, but when diseases strike, everybody enters the panic mode. According to the Oxford Dictionary, a disease is defined as a disorder of structure or function in a human, animal, or plant, especially one that produces specific symptoms or that affects a specific location and is not simply a direct result of physical injury. The World Health Organization states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. With its many water sources, Kenya has a high rate of waterborne and mosquito-carried diseases. Malaria strikes over 8 million people each year. However, one of the leading causes of mortality in Kenya has been HIV and AIDS, which kills around 80,000 people per year. This has left close to 1.2 million children without one or both parents. Another health issue that causes death or contributes to other health problems is malnutrition, especially among children. Approximately 7.5 million children under the age of 5 die from malnutrition, and it is usually brought on by not having money to find or make food. According to Demographics and Health Survey by Kenya National Bureau of Statistics from May to October 2014, in partnership with the Ministry of Health and other stakeholders, the infant mortality rate is 39 deaths per 1,000 live births, and under 5, mortality is 52 deaths per 1,000 live births. At this level, about 1 in every 26 Kenyan children dies before reaching the age of 1, and about 1 in every 19 does not survive to his or her 5th birthday. 79% of children aged 12 to 23 months have received all basic vaccines. On nutrition status, 26% of children under the age of 5 years old are stunted, 4% are wasted, and 11% are underweight. 9% of women aged between the years of 15 and 49 are thin and undernourished. 33% are either overweight or obese, and 10% are obese. On AIDS, only 56% of women and 66% of men have the knowledge about HIV and AIDS prevention and transmission. With the government recognizing that good health is a prerequisite to socio-economic development, it has laid special emphasis on the health of its citizens and the improvement of health service delivery. Lack of easy access to unimproved water sources may limit the quality of sustainable drinking water that is available to each household, as well as increase the risk of illness. Globally, cancer causes more deaths than HIV, TB, and malaria combined. 70% of global cancer burden is in low and middle income countries like Kenya. 30% of cancers are treatable with prolonged survival if detected early, while 30% of cancer patients can be provided with adequate symptom management and palliative care. Cancer is the third highest cause of morbidity in Kenya, causing at least 7% of deaths per year after infectious and cardiovascular diseases. It is estimated that 39,000 new cases of cancer arise each year, with more than 27,000 deaths occurring per year. 60% of Kenyans affected by cancer are younger than 70 years old. Leading cancer cases are as follows. Amongst the women, breast cancer 34 per 100,000, cervical 25 per 100,000. Amongst the men, prostate 17 per 100,000, esophageal 9 per 100,000. The estimated diabetes prevalence in Kenya ranges between 2.7% in rural areas and 10.7% in urban. The prevalence of impaired glucose tolerance is 8.8% in rural areas and 14.4% in urban areas. In 2003, non-communicable diseases such as diabetes, cardiovascular diseases, chronic lung disease, and cancer contributed to 53% of hospital admissions in Kenya. Diabetes accounted to 27% of these hospital admissions. According to World Health Ranking, the following are the top 10 leading causes of deaths in Kenya. Influenza and pneumonia leads, followed by HIV and AIDS. Stroke follows. Diarrhea, malnutrition, coronary heart disease, tuberculosis, diabetes mellitus, prostate cancer, and malaria.
Welcome back, dear viewer. We hope you have been really informed by our program. Remember to hit us up on our Twitter handle at @hope_Kenya, #HealthWatch. Welcome back, Daktari.
Thank you, Eva.
Parents lately have been taking their children, especially underage children. We really take them to the hospital a lot. What's your take on this?
Well, I would like to say that not all diseases sometimes or ailments you have to rush to the hospital. But I think the problem has been health education, making parents aware of the conditions that they can take to the hospital when they see their children suffer from, and for them not to rush to buy medication, because there's a lot of self-medication also. But I would like to say that in the most cases where the child has a fever, it's very important to go to the hospital. And rather than giving paracetamol over and over, because you don't know why there is a fever. But also, in our system, I don't think we have embraced so much in teaching the parents what to look for and when to come to the hospital. And also to give them a system where they can be able to get information even when they are in their homes and direct them what they should do. I think that's the area whereby parents, because of lack of that education, lack of that information, they rush to the hospital. And that sometimes leads to abuse of drugs. And many times we see clinicians just prescribing antibiotics without evidence, and therefore causing the children to develop resistance, disrupting their developing immunity, and making them to be very resistant to very simple medication that could help them along the way. And therefore making these children to fall sick very often. Because, you know, at that age, the digestive system is developing. And one of the things that develop in the digestive system is good bacteria, what you call microbiota. Good bacteria that helps in digestion. So when you are taking a lot of antibiotics, that means that you are shedding off that good bacteria. And therefore, along the way, they start having problems with digestion and poor absorption of nutrients. And therefore, antibiotics should only be given when there's evidence to give antibiotics. Drugs should only be given when there's evidence there's a disease to be treated, but not just giving blanketly, because it affects the children in their growth, in the development of their immunity. Therefore, my advice to the parent is you need to ask your doctor when you go to the hospital how to take care of your child in case the pediatrician they'll explain to the parent what to take care, what to look for, what are the things that they must have take their children to hospital. Not every ailment, because flus are always there. So you cannot be in the hospital all the time there's a flu. Unless there's a fever, I'll advise parents to go to the hospital if there's a fever, because you don't know what disease or what infection the child may be having.
I have a parent who has been complaining about his son. Every time the son goes to school, the son gets a cough. And when he's at home, he doesn't get a cough. What do you think would be the cause of this? And what would you advise the parent as a preventive measure of this occurrence?
Well, I may not know the circumstances that surrounding that child. One, the traveling to the school. Two, the environment around the school. Three, what that parent gives that child during the holidays, and other factors like other children getting coughs, flu, because these are common ailments that children get. So, one, children who continuously have coughs, sometimes they may be having some defect along the airway, what we call maybe enlargement of the adenoids. Sometimes it can be that we're exposing the children to sugary foods. Sometimes it can be we're exposing the children to a lot of soft drinks. Because many a times when children go for parties and they take a lot of soft drinks and sugary things, they are always having throat problems, tonsils, and coughs. Why? Because sugar irritates the growing lining and also puts the immunity of that child low, and therefore they easily get these conditions. The other thing is exposure of that child during the traveling. You see, there's a lot of pollution. The smoke, yeah? If that child has an allergy, if the mother has an allergy or there's a family allergy, then this child, because of that inhaling of the smoke along the road, it can cause the child to have coughs. Also the school environment. You know, children play, there's a dust. Maybe he lives in apartments, the area is very clean. Yeah? You see, children is good, they interact with the environment.
Yeah.
You'll find out that children who live in the shags, where they interact with the soil, they not fall often sick. But children who live in these places, because it's very clean, when they start interact with that environment, they'll have to be sick. But sometimes we should not rush to medication, because they're actually building the immunity.
Yeah.
But if it's a continuous thing, either there's an allergy in the family, or either there's some kind of exposure. And he needs to go to see the doctor, maybe an ENT doctor, and he'll be able to be advised. He may also need to see a nutritionist or preventive wellness doctor, because there are areas around the child that may be contributing to that. Yeah.
Oh, thank you very much. Now, as a preventive and wellness doctor, what would you advise as are the safe health practices that can uphold wellness?
Well, simply, we have mentioned a few of them, but being practical, one is nutrition. Good nutrition, balanced diet. And we talked about fruits, vegetables, they're very key. You may realize that many people don't take fruits, they don't take vegetables. And if they take fruits, they may take it in the wrong way. If they take vegetables, they may be cooking in the wrong way. Many people don't take raw vegetables. And also, many people, when it comes to nutrition, also, you can see the pattern of eating. They may be eating one food, maybe the whole week.
Yeah.
If you go and make an audit of the food that people eat, it may be only 3 or 4 foods. Ugali, sukuma, mchana, ugali, maharagwe, jioni, maybe rice. You see, it's only a few. But God has given us all variety. Of course, it depends on the availability of these varieties, but we are saying mix, pick here and there, so that you can get nutrients from all those foods that God has given us. Then, of course, exercise. Exercise is key. And here we're talking about exercise is scientific. You cannot say you are walking from here to the market, is that exercise? It's physical activity. But exercise, in that you have to sweat. There has to be some sweat. You have to feel it. That's exercise. And we advise at least 3 times in a week, if you can. Also, we're talking about sleep well, good sleep. That's why God created the night and created the day. You know, right now, we are going to sleep. So after afternoon, the body is resting. So if you still want your body to be up in the night, that means you're not giving your body the right thing. But also the other thing is that regularity of that sleep is important. Regular times of going to sleep, regular times of waking up. Also, we are talking about rest. Take good rest. Don't overwork. Get some rest. Of course, now we are going for holidays, but there are people who never go for holidays. There are people who they are working 24 hours, 7 days. Your body shuts down. Of course, good taking water. Enough water, 6 to 8 glasses, clean water. Those are good habits. But also we need to avoid a lot of processed foods. We need to eat real food. If you can get our foods from the shamba, that would be good. If it's not available, then you can mix here and there.
Thank you very much, Daktari, and we are glad you came to our show today. Now, as this is the festive season, look at your camera. Talk directly to my viewer and tell my viewer advise them on how they're going to handle themselves during this time so that they can be able to continue living healthy.
Well, holiday is very good. It's good for us. It's good for the family. It's good for the community. It's good for the country. And the things that make up a holiday is family togetherness. You meet relatives that you have not met for some time, and therefore you enjoy their being there, their presence. Also, during this season, there'll be a lot of traveling. Please take care of yourself. Be safe on the roads. If you want to travel with your car, make sure it's been checked very well. Don't avoid traveling a lot at night. It's good to travel during the day. Also, the other things that make holidays is eating. And this is where most of the challenges that we have. We've said you have been working the whole year. You've been missing some food sometimes because you're busy. You've been skipping meals. And here you have all the times you're at home. You're eating from morning to evening. There are so many snacks. And some, because you have not eaten certain food for some time, you take it in abundance. What you're saying here is that because your stomach or your digestive system has been used to certain system, when you all of a sudden put a lot of food within a short period of time, you cause some shocks in that body because there'll be a lot of indigestion, yeah? And people will have problems with even constipation. Also, the other part that will affect us is handling of food and storage of food. Sometimes, if the food is not stored very well, we can have people who will have problems with diarrhea. Also, we look at the area of drinking. You know, there are people who have never drank and who will drink during this holiday. It's not good for your health. We are saying avoid that which harm, and that which is good, do it in moderation. So don't jump into taking alcohol, smoking. Those are not good for your health. We say if you want to embrace wellness, it is good to avoid that which is harmful. But also remember, there are sports during this holiday. Engage yourself in sports. For those who go to the beaches, go swim, go do football on the beach, you go mountain climbing, enjoy yourself. So involve yourself in sports. The body does not, you don't stop your way of living. If you've been going to the gym, it does not mean that you take a holiday from the gym. No, you can still continue with your gym, which will continue with your exercise. And therefore, all these integral areas of maintaining health should be there during the holidays. And what you can say, enjoy your holidays, and also may God bless you as you plan for the next year. And don't finish all the funds, because next year is coming and we are going to have a lot of fees to pay and bills to pay also.
Thank you very much, Dr. Kahindi. And thank you very much, dear viewer, for joining us for our show today. Remember, avoid that which is harmful this holiday season. Thank you for spending time at Health Watch. Don't forget to hit us up on our Facebook page, Hope Channel Kenya. Our Twitter handle remains Hope_Kenya, #HealthWatch. Keep healthy, keep wealthy.